This is a swollen knee injury case study by Jack Stewart. So starting with the background, this patient is a 15-year-old male. This patient also claims to have mild pain in the patellar tendon region prior to the acute onset of knee pain on October 31st. The patient was playing basketball on October 31st, 2006. He twisted and jumped quickly. When he landed, there was an acute knee pain in the left leg. He claimed to have mild pain in the patellar tendon region for about a week prior to the incident on October 31st. He claims his quality of life has decreased. Since the incident, he feels that his left knee is unstable and he has a limited range of motion with the injured knee, which is 0 to 85 degrees. The patient is barely able to do a straight leg raise. The patient was diagnosed with a stress reaction at the tibial tubercle, Osgood-Schlatter disease, patellar tendinitis that is fairly substantial, edema changes at the tibial tubercle, a pre-existing anterior cruciate ligament tear with positive Trace-Lachman test, and the patient ambulates with a slight antalgic gait. Now it's time for what it all means. The stress reaction and edema changes occur when the body is unable to heal properly in response to repetitive muscle contractions and tibial strain. Osgood-Schlatter disease is inflammation of the patellar ligament at the tibial tuberosity. Patellar tendinitis is an injury to the tissue connecting the kneecap to the shin bone, and pre-existing anterior cruciate ligament tear is an ACL tear is when the anterior cruciate ligament becomes partially or completely ruptured. Once torn, the ACL cannot regrow or heal on its own. And finally, the antalgic gait is a gait that develops as a way to avoid pain while walking. On to word power. Tibial tubercle can be broken down into tibial, meaning on the tibia, and tubercle, meaning a small rounded point of a bone. Osgood-Schlatter disease is the condition named after Robert Bailey Osgood, an American orthopedic surgeon, and Carl B. Schlatter, a Swiss surgeon. Patellar tendinitis is broken down in patellar, meaning in the kneecap, and tendinitis, meaning inflammation of a tendon. ACL tear is broken down into ACL, meaning anterior cruciate ligament, and tear, meaning was ripped or pulled apart. Antalgic gait can be broken down into the anti-prefix, meaning against, and alg, meaning pain. Gait means a person's manner of walking. Now the background and treatment of stress reaction on tibial tubercle. It occurs when the body is unable to heal properly in response to repetitive muscle contractions and tibial strain. Tibial tuberosity is often enlarged and painful. It hurts when bumped. It also hurts when pressure is put on it, such as when kneeling. Treatment typically includes non-steroidal anti-inflammatory drugs for the pain, physical therapy, and in some cases also splinting the knee for a few weeks. Next is background and treatment of Osgood-Schlatter disease. It's usually caused by irritation of the bone growth plate during development. The disease causes a painful lump below the kneecap, and the condition usually resolves on its own once the child's bones stop growing. Background and treatment of patellar tendinitis. An injury to the tissue connecting the kneecap to the shin bone causes patellar tendinitis. It results in inflammation of the patellar tendon, which can cause irritation and sharp pain. Physical therapy and pain relief medication are often prescribed. Now we're on to background and treatment of an ACL tear. As far as causes, it most commonly occurs when extreme amounts of force are exerted on the ligament during sports. Severe pain and inability to continue the activity are usually the effects. Rapid swelling is another effect. Treatment: the ACL cannot regrow or heal on its own, so the surgery and physical therapy is required. Background and treatment of antalgic gait. It develops in response to pain, often in the foot, knee, or hip. An abnormal pattern of walking secondary to pain that causes a limp is an effect on the body. Physical therapy and lots of rest over time help treat the antalgic gait. Here's a bar graph showing the prominence of Osgood-Schlatter disease in different age groups. Last but not least, we have the current status of the patient. The patient has been restricting his activities for the past month and is no longer complaining of pain. The patient ambulates without an antalgic gait, and he is able to do single leg hop 10 times. There is no effusion to the knee, and he has no medial or lateral joint line tenderness. Overall, the knee is substantially better, and he is now able to return to his athletic activities. Now I have my bibliography. That's all. Thank you.